Hey PT students, here's a short video on congenital muscular torticollis. Let's talk about the clinical practice guidelines pertaining to CMT from the APTA. As a physical therapist, we must describe the evidence supporting PT management, define common CMT impairments, identify appropriate outcome measures, and identify interventions supported by evidence. When determining if a child developed torticollis, we look at the birth history. This includes forceps, position, and whether it was multiple births. As well, we look into if the baby can tolerate prone, feeding, any positioning devices, and the general position of the child. Important tests include a visual tracking, which is rescreened at 4 months, neuroscreen, and a hip screen. We also have several observations like cervical ROM, MMT, and tone of UELE, developmental milestones, head writing, muscle function scale, head shape, and palpation. The primary standardized test utilized is the ASQ-3. There are a range of interventions used by the therapist like ROM exercises, position changes during sleeping and feeding, environmental adaptations like a different car seat or rearranging objects in the room, strengthening like lateral neck writing and tummy time, developing symmetrical movement, education, TOT collar or Bennick, kinesiotaping, traditional Chinese medicine massage, microcurrent, and soft tissue mobilization. We will then write appropriate goals, usually in PROM, AROM, head position, MFS scores, and symmetry. Lastly, this patient will be seen weekly until function returns, and then every other week or based on family needs. They will need one follow-up at the time of walking. However, if plagiocephaly is present, they still will need PT.